Food Bank of Western New York mission. The Food Bank of Western New York is a nonprofit agency that works to eradicate hunger in Western New York through obtaining and distributing food to hungry individuals in many counties. It works with multiple agencies, including food pantry, soup kitchen, shelters, youth program, group home, and senior center. This makes it possible to serve 129,000 people a month. For the purpose of this assignment, we choose to analyze data from Trinity Food Pantry in Lancaster, New York, located in Erie County. As a public health nurses, we served our respected communities and assisted recipients in healthy food selection, healthy portions, and nutrition education. The main purpose of this service learning project is the focus on hunger and poverty. It helps the community nurse to analyze the community census data, allowing evaluation of the root causes of hunger and different approaches to solving the problem of hunger and poverty. Population data for Lancaster, New York, located in Erie County. As you can see from this chart, 95% of the residents in Lancaster have a high school diploma compared to 90.4% in Erie County as a whole. When it comes to secondary education, 31.5% of residents have a bachelor's degree or higher compared to 31.6% of residents of Buffalo. As you can see from this chart, Lancaster has a poverty level of 5.8%. The median household income is $67,223, which is higher than the state and the county rate. 4.9% of the people in this community speaks a foreign language, and 4.8% of the adults from 18 to 64 are without insurance. Although this community has a higher income level and less people in poverty, the people who are impoverished have less access to social services, job, and transportation. The purpose of this service learning is to connect with people in this group. Social determinants of health in Erie County. Public transportation in Erie County is controlled by NFTA and limited to within the city of Buffalo borders. There is inadequate coverage of bus lines linking the city of Buffalo. This makes it difficult to get a job or even get help for those in need. When people cannot work, it makes it difficult to afford food. It's well known that a lack of access to nutritious food can lead to poor health outcome and nutritional deficiencies. Erie County has the highest diabetes incidence than the state and nation. Within the Erie County, Black and Hispanic have disproportionately high hospital admission rate relative to the expected rates for diabetes-related conditions. Cardiovascular disease is the leading cause of death in Erie County. Erie County residents experience 33% more heart disease death than the average U.S. citizen. 19.2% of the Erie County adult population currently reports smoking. The percentage of Erie County adults who are overweight or obese is 62.7%. According to the Erie County Department of Health, more than 75% of the housing stock in Erie County overall was built before 1970, and it is likely to contain lead-based paint. Housing choices for very low income and low income families are very often limited to the oldest housing most in need for maintenance, with the high risk of lead-based paint hazard. The public health core function that is served by the Food Bank of Western New York is reducing hunger one family at a time. Places that work in conjunction with Food Bank of Western New York have services that can help families keep adequate food in their homes. They can direct individuals on how to contact social services to get emergency food stamps or how to fill out application for services for monetary assistance. Our primary intervention include educating the community on the effects of hunger and health. This should include resources such as local food banks in the area or organization that is affiliated with Food Bank of Western New York. According to CDC, hunger and household food insecurity have been associated with non-communicable diseases. The association between hunger and non-daily fruit and vegetable consumption and inadequate physical activity is supported by research finding association with household food insecurity. Insufficient access to high nutrient-dense food in general could lead the nutrient deficiency and a poor general health, which might impede participation of a physical activity. This education should include information on nutritious food selection and ways to obtain them in the community in which they live in. Secondary intervention include screening individuals for being at risk for hunger and extreme poverty. This may also include lessening the impact of poverty and hunger by providing food from the pantry weekly. Our tertiary intervention should be aimed at taking care of those who are actively affected by hunger. This includes counseling services, addressing any health issue related to hunger, connecting them with social services, and teaching them life skills to change their situations. Community nursing diagnosis for Erie County. In order to develop our community diagnosis, we identify our problem as a poverty in the suburbs that makes it difficult to afford food. Through further research, we discovered that the poverty in the suburbs poses some unique challenges compared to poor communities in the city. They are often more geographically isolated from jobs and the lack of transit connection that can help link residents to employment opportunities. Since public transportation is virtually non-existent in the suburbs of Lancaster, local food pantries are especially important for the residents who have limited income for food. According to NFTA Metro, there is only one stop in all Lancaster, making it difficult to take advantage of the services unless residents live very close to this stop. The city of Buffalo serves a large population and has over 100 stops to choose from, making the chance of living close to one much higher than in Lancaster. Our community nursing diagnosis: people living in poverty at a rate of 5.8% in Lancaster have a low budget for food related to low median household income and decreased access to public transportation related to the lack of a transit connection in the suburbs, with only one NFTA Metro bus stop compared to connections in the city of Buffalo, which totals over 100 bus stops location. In the future, to improve our service activity relative to the population served, we would gather all population data before going to participate in helping in the food pantry and put together a full presentation to help illustrate the effects of poverty and hunger in their specific community. If people that utilize the services provided by the food pantry can see the data in a way that interests them, it might be a lot more helpful to them. See references.